Get a letter like
Number 11.
We're with her.
You're with her.
Oh, yes.
Number 11.
I got number 11. They done me.
Where are you? Vision.
Number 5.
Okay.
4.
You all just keep coming, 11.
Absolutely no change in the number of people that come to these events since the day I started it here in the United States, which was, 30 years ago or more. How many short are we from 300?
88.
88 short?
Yeah, we're at 30%.
Wow. Yeah, right at 30% when they go home, they don't come back.
Right.
A few steps away
Yeah,
now.
right. But at 5 o'clock, I asked for a show of hands. How many people are here to see the dentist? And all the hands went up. It was a sea of hands. It's the same everywhere. And then I said, how many people are here to see the eye doctor? And it was a sea of hands again. It was the same people. Okay, they want both. And it's not provided. It wasn't in the Affordable Care Act. It's not in the House version of the Affordable Care Act. It's not in the Senate version of the Affordable Care Act. And whatever they pass, I'm pretty darn sure, unfortunately, that it won't be in whatever they do pass. And it's a big mistake because bad teeth lead to diabetes and heart disease and death. People die in this country from bad teeth.
We're on the front lines here, and we see the death that occurs here almost on a daily basis. Somebody comes in our clinic, and I mean they're dealing with life-threatening conditions where they have put off their health care for so long. They are train wrecks of patients, and they've not had the health care.
That'd be great.
Let's get on the forefront of prevention. Let's remove those polyps before they turn cancerous. I mean, it's like and it's just it's atrocity that the healthcare system is in such disrepair in the United States. And the politicians, they want to vote their party party line, and they cannot be nonpartisan, and they cannot do the right thing for their constituents. At the end of the day, they forget that they are the servants, and we should be the masters. But somehow they've got it just backward, and they don't have to worry about it because they've got good insurance, and they don't have to, pay the high co-pays and high deductibles and stuff like that. But they need to come here and see the working poor and what they have to, deal with, to buy insulin. I mean, it is atrocity for us when they come into the clinic. And what stands between them and their life is some cash to buy the insulin. And we can't. We're a free clinic, and we have limited resources. And it's horrible for us as providers to say, I don't have your insulin. And that they're going to. I mean, we get them in at the later stages when they've got the kidney disease. When we're looking at amputations. And retinopathy, when they're going blind, when they call and they say, I'm just seeing shades of red today, and that you're dealing with proliferative diabetic retinopathy because we couldn't get their insulin. It's just healthcare in the United States is pathetic. I mean, we've got a good healthcare system, but when you don't have the insurance, you don't have the access.
I had 5 root canals done. I'd planned the next year to have crowns put on them, and then whatever happened, and I no longer worked. And so once you lose your job, then you no longer have money. And so it's wonderful to be able to do this. And the people here are awesome. They don't make you feel intimidated. As you can imagine, you might feel a little bit, but they want to help you. They want to be here. They want to be doing this, and it makes you feel appreciated. And when you don't have money, you can't do this on your own. When somebody can make you feel appreciated, that is worth a lot.
Because of infection and pain, the fact that now they can't eat and they have no self-confidence and can't get a job is secondary to the fact that the teeth had to come out. So that's why we're trying to fill the niche of at least creating some smiles, creating some function, so these people can go out, get out and get jobs. That's a big thing.
She just told me in 2008 that she got diagnosed and she had cancer. But for that diagnosis that she had in 2008, she would not be alive today were it not for this RAM clinic. This clinic has saved lives. It saved this young woman's life. Let's give her a great round of applause.